So today is September 5th. It's one day before I'm getting my nose repaired, which is a result from pulling the tube during surgery, which put my septum from straight to sideways, because when they pulled the breathing tube, I'm not sure that the technician was aware of the stitch in there for the detached septum that was a result of separating my jaw and then attaching it with plates and screws. So it's been a problem all summer and through the entire recovery. It is about 9 o'clock in the morning, and I've been up for a little over 3 hours, and you can see how soft and puffy my face is in here, which is just the inflammation that I have every single day from both my nose, I believe, and sinuses, as well as the screws and the proximity of the screws to the sinus. So tomorrow, when I have surgery, they are going to have to rebuild the septum on the inside by using rib cartilage and a graft of a rib bone, because it's now my second surgery on my nose. Previous one was before the jaw surgery, and 5 months into recovery, and constant reminder of the nose thing over everything. So I'm looking forward to. I'm not looking forward to the surgery and the recovery, because it's a much more major surgery than it should be, but it is what it is, and hopefully I'll get the relief from the pressure. The screws and plates, as I mentioned, that are around my sinuses, because they're going into my nose, we have an opportunity to get those taken out, and hopefully that will also create some space and room for the tissue, the soft tissue around it, and hopefully get rid of this like daily swelling in my face around my nose and my mouth, which will create a better opportunity for me to smile without crunching up my face and looking kind of different. The nasally discussion, or the nasally sound when I speak, is annoying when I hear it inside my head, and people ask if I have a cold or allergies or whatever, and hopefully that'll go away too. Maybe it won't, maybe it will, I'm not really sure. Obviously I've gotten used to it and can live with it. Upper lip numbness, tingly sensation, and control muscle-wise is still an interesting thing, because of I've basically created a lisp, and hopefully that will be resolved as well, only because having more a nose that's in a more normal state and not straddled across my face, taking up space, having some of the tissue taken out that was a result of like the jaw being pushed forward and out. Hopefully all of that will create just a little bit more comfort around this part of my face in here, and if the swelling goes away just from the sinuses acting and working normally, and the nose working normally by having a real septum and not a sideways one, hopefully that will alleviate some of the things that's causing the inflammation every day. If it doesn't work, I guess I'm SOL, but I'm encouraged that they believe that it'll be very successful, and then I'll really be on my way to healing properly, and that is what I'm excited about. So we'll see. I'll probably check in again tomorrow, and I'm gonna clip all of these together and create sort of a big documentary / blog, and we'll see how much editing needs to be done, because there's a lot of rambling in a lot of these, but hopefully if you've gotten to go through jaw advancement surgery like this, hopefully you will have learned from my experiences. So thanks.